going to discuss hypertension and BP, blood pressure. So blood pressure means cardiac output into peripheral resistance. So what the factor affect the cardiac output and what the factor affect the peripheral resistance? So we are going to discuss. So regarding cardiac output, so when we discuss regarding the cardiac factor, in the cardiac factor, there is like a heart rate and contractibility. If heart is more forcefully contracting and there is a more heart rate, so there is a increase also the BP. And regarding the there is like blood volume also blood volume is responsible for the cardiac output. So in the blood volume there is like some factor like sodium, how amount of sodium ion is present in the blood volume. There is like mineralocorticoids and there is how much amount of the arterial natriuretic factor ANF. This determine the like volume, amount of the volume. So if it are increasing, so increase the cardiac output, so increase the BP, blood pressure. Regarding the peripheral resistance, so there is a hormonal factor and the neuronal factor. So first we discuss regarding the neuronal factor. What are the neural factor that affecting the BP? So there is a constrictor and dilator. If we dilate the blood vessel, if this is a normal, and if we dilate the blood vessel, so there is a decreased peripheral resistance and so decrease the BP, so lead to decrease BP. If we constrict the blood vessel, and when we constrict the blood vessel, so there is a increase the peripheral resistance, so lead to increase BP. Peripheral resistance that lead to the increased BP. So what the like there is, if the in the constrictor there is a alpha adrenergic, if there is estimation of alpha adrenergic, so after the estimating the there is a constriction occur. If we stimulate the beta adrenergic, so there is a dilation adrenergic. So regarding the peripheral resistance, there is a hormonal factors. So regarding hormonal factors, there is like some constrictor and dilator. So we also classify as the constrictor and dilator. So in the constrictor there is like angiotensin 2 it's constrict the vessels. Also there is like catecholamines, thromboxane. Then there is a leukotriene and endothelin. Leukotriene and endothelin. These are the some hormonal constrictors that constrict the blood vessel and that lead to the increase peripheral resistance, and when they increase peripheral increase the BP. So some dilator. Regarding the some dilator hormones, there is like prostaglandin, also kinin, and there is a nitric oxide. These are the dilators, so dilate the blood vessel and that they decrease the peripheral resistance. When they are decreasing the peripheral resistance, that leads to the decrease in BP. And also there is some local factors. Regarding the local factors like locally available in the blood vessel. So local factors are there is a autoregulation in the local factor, autoregulation pH. If autoregulation photoregulation, regulation BP, and there is a hypoxia. If there is a hypoxia condition, so there is a vasodilation occur, hypoxia. These are the regarding the BP, how BP is controlled by the hormonal response and all other like blood volume and the like cardiac factor, cardiac factor, how to the control the BP, how to increase or decrease the BP. So discuss regarding angiotensin system, how angiotensin control the blood pressure, how angiotensin control the blood pressure. So first, this is the table of normotension. There is a normal blood pressure, normal blood pressure. So a condition where the blood pressure increase, BP is increase, and where the condition BP is decrease. This and what the factor affecting the increasing blood pressure and decreasing blood pressure. So there is, and also we make here is the beautiful our heart. This is heart. So heart release, arterial natriuretic factor, and its function is the like blood vessel, on the blood vessel and in the kidney. So in the kidney, this factor, and in the blood vessel, this factor lead to the vasodilation, and in the kidney there is a excretion of sodium and water, that lead to the decreased volume of the blood volume. And when the blood volume decrease, that lead to a decrease in BP, and also vasodilation lead to a decrease in BP. Initially we have discussed, like vasodilation there is a peripheral decrease, and then the blood volume also will decrease the BP. When the BP is decreased, so low volume and low resistance renal artery stenosis. If the condition of the renal stenosis, so kidney sense that there is a decrease in the BP. When kidney sense there is a decrease in BP, so that lead to the like secrete renin, and at that time liver also produce angiotensinogen, and renin convert this angiotensin into angiotensin 1. And there is also we have a beautiful organ, this is known as lungs, and lungs produce ACE, and this ACE convert angiotensin 1 into angiotensin 2, and this angiotensin 2 have the like lots of function, like this angiotensin 2 go into the blood vessel, also go into the adrenal gland. So this angiotensin 2 go into the adrenal gland. This is adrenal gland and adrenal. So adrenal gland and stimulate to the produce aldosterone. When aldosterone produce, it's go into the kidney, and stimulate to the reabsorption of sodium and water, and that sodium and water increase volume, help to the increase blood volume. When blood volume increase BP, and also this aldosterone go into the blood vessel. This is the blood vessel, and lead to the constriction of blood vessel, and due to this increase peripheral resistance, and this increase in peripheral resistance lead to increase in BP. So this is the phenomenon when the BP is increased. So when BP is increased going to, by the heart, there is BP increase. So in the BP increase there is a volume overload. volume overload. This is normal regulation of the blood pressure. And after that we discussed regarding the hypertension, and there is a like cause of the hypertension and initial cause of type and cause of the hypertension. So when regarding the types and the causes of hypertension. So initially there is like 90 to 95% of patient 90 to 95% of patient are essential, they have it without idiopathic or without any causes, like essential hypertension. Then after that there is like secondary hypertension. This is in the primary. So secondary cause of hypertension is divided as like renal cause. Then there is a endocrine cause. Then there is a like cardiovascular cause. Then there is a like neurogenic cause. Neurological cause. So regarding the renal cause, in the renal cause there is a acute glomerulonephritis. Then there is a like chronic renal disease. If the patient is chronic, there is a hypertension, chronic renal disease. Then there is a like polycystic disease is also cause of the renal. There is a like renal artery stenosis. Then after that there is like renal vasculitis. Then there is renin producing tumor. If the more production of the renin, that leads to also the hypertension. The renin producing tumor. These are the some tumors. These are the causes of the renal. So after that the renal, there is an endocrine cause. So in the endocrine cause there is a adrenocortical hyperfunction. Like if the adrenaline is more secreted, like in the Cushing syndrome. Then there is primary aldosteronism. Then there is a like adrenal hyperplasia, congenital adrenal hyperplasia. Congenital adrenal hyperplasia. Then after that there is other causes like exogenous hormone production like glucocorticoid, estrogen, and there is pheochromocytoma. Then there is a acromegaly. If there is a more growth hormone production, there is also acromegaly, hypotension. And if there is a hyperparathyroidism, also hyperthyroidism condition. Hyperthyroidism. Then there is like also pregnancy induced like preeclampsia, pregnancy induced hypertension known as preeclampsia. And regarding hypothyroidism, there is a thyrotoxicosis. There is more production of T3 and T4, and that lead to the hyperthyroidism. That leads to hyperthyroidism, and that leads to hypertension. And after that, cardiovascular system, there is like coagulation of aorta. Coagulation of aorta. Then there is like polyarteritis nodosa. nodosa. Then there is like increased intravascular volume, increase intravascular volume. Then there is a rigidity of or increased cardiac output, and then there is rigidity of the aorta. If rigidity of aorta, in the aorta there is baroreceptor that sense that pressure. So rigidity of aorta also lead to cardiovascular causes, also lead to the hypertension. So after that, neurological. So neurologic, in the neurology, there is a psychogenic. Then there is increase intracranial pressure. If the intracranial pressure, increase intracranial pressure, cranial pressure that lead to the increase in pressure, hypertension, and also sleep apnea. Then another is the acute stress or including the surgery. Acute stress and including surgery. These are the causes of the hypertension of the how hypertension is in the some patient occur, and this is the causes. And also we have discussed in the physiology how there is a maintenance of the hypertension blood pressure. And after that, there is some disorder increased pressure. So increased volume, there is excessive dietary sodium or the inadequate excretion of the renal failure, also hyperaldosteronism, and increased sodium reabsorption Giltman, Batter, and Liddle syndrome, and also increased resistance increased sympathetic tone or the pheochromocytoma, increased renin-angiotensin aldosterone axis. These are the causes of the increased pressure. So regarding this